Good morning, everyone. Welcome for part two of the Molina presentation. And Brad, can you see my screen? Is it showing up pretty good?
I sure can. Yeah, it is.
Okay, so we're off and running today, October 16th. You know, um, down here in Cincinnati, we're delighted because tomorrow is the start of this incredible art festival called Blink, and everybody is just abuzz about this incredible art thing going on here up in the Cleveland area. Of course, not the Indians, the Guardians are in the playoffs, and so much is going on, and we're in the throes of AEP right now, and then we're going to be in OEP just in a couple of weeks. And let me just get started. This is going to be the part two of the Molina plan preview. And you know the drill. You got a question? Just throw it in the question box. I'm going to jump in. Brad's going to jump in if you got a question. We'll let Kahassai answer them as we go along. And here we are, the dynamic duo of the individual market here in Ohio and surrounding states. If you need to get a hold of Brad, he's Northern Ohio. There's his phone number, and by the same token, there's my information. And okay. And with that, I'm going to toss things to Kahassai. Kahassai, can you hear me?
Yes, I can hear you.
Okay, great.
And
Good
just
morning,
give me
everyone.
and share my.
Yeah. Good morning, everyone. Kasai is our regional rep for Molina, obviously. Some of you have heard him before. He's got some pretty cool stuff to share with you all this morning about expansion counties, increased commission. So good stuff. So Kasai, whenever you're ready, fire away. And
All right,
again,
thank you.
everybody, this is like part two, right? So, if some of you were on the call earlier that we did nearly a month ago now, it seems, we just wanted to give Kasai an opportunity to share plan benefits, which he didn't fully have at that time. He cobbled together a nice presentation, but because they're a key carrier for us, we wanted to make sure that we gave him the full measure of a presentation. So, Kasai, all you, take it away, my friend.
Thank you,
Yeah,
Brad. Thank you, Jeff. Appreciate the opportunity. And like I said, this is a second part two, and we have had quite a number of trainings in the past few weeks. I'm sure many of you have jumped on those. I'll be sure to send a copy of this more comprehensive, a national training deck, so you have it as a reference point, just in case some of you do sell outside of the three states that we're going to cover this morning, which will be Ohio, Michigan, and Kentucky. So I'll skip over some slides that I think just to save time, and so we'll have more time for Q&A. All right, so I'm not going to go over this. You guys know what open enrollment is, when it starts. So I don't think we need to go over some of this stuff. Here's our national footprint for those of you who may be interested in adding some states that you may be licensed as in non-res. So certainly you can log into your broker portal and add any Molina states that you intend to sell. It's a really simple process. Ohio is one of our biggest ACA state, which did really well last year, in which we had new enrollments upwards of 35,000 new members. Currently, we sit on above 80,000 ACA members in the state of Ohio. We're expanding into um, 15 additional counties for 2025 listed here for you. And then I think one of the biggest one is Delaware County. And I say that because many of you have been asking, especially those of you that are in Central Ohio, when we would be expanding into Delaware County. So happy to let you know that we are going to be in Delaware County for 2025. And I think it's a pretty affluent community with probably high potential for ACA enrollment in that county. So certainly welcome um, change. We anticipate we'll be in the entire state as far as ACA is concerned, because we are for Medicaid and Medicare. in the entire, all 88 counties. So that's Ohio for you. And Kentucky, as far as expansion, we're expanding into 5 additional counties. A few interesting things to point out about Kentucky. We're going to go over the products for both Ohio, Michigan, and Kentucky, but just wanted to point out, as far as price positioning for Molina, we are pretty much staying flat, no increase, no decrease in that stay in Kentucky as far as price positioning, compare to the 2 top competitors in that state, increasing in pricing at 10 and 13%. And one of the top carrier there is going to be pulling out of 20 plus counties, really giving Molina an opportunity to to be an option for people who may have to move some of their policies. So I truly believe we're positioned to do well. Our network is fairly decent in that state, and we have the name recognition with Molina Passport program as far as Medicaid and Medicare. So I think this state is going to be a good one. Obviously, the challenge is the state platform, the Connect enrollment platform. But I believe from what we hear has improved quite a bit, and people are able to enroll individuals within 25 to 30 minutes using the Connect system, is what I'm hearing. So obviously, if you're familiar with that system, you're going to do well. Unfortunately, we don't have the option of using Health Sherpa types of EDE type of platforms in this state.
Yeah, and Kasai, if I could jump in on Kentucky, they are acutely aware of the system challenges, and they've made a really bold effort to remedy that
Yeah.
this
Yes.
year. And they really need, just statewide, they're trying to ramp up the ACA enrollments. They're lagging behind other states, and the number one obstacle has been that enrollment platform for a lot of agents. So take another look at Kentucky if you haven't already,
Yeah.
and I can help you get you started on that.
That's right. Thank you. Michigan, we are not expanding into any additional counties. We'll stay in and around the Wayne County, the Detroit market, and then up in northwestern Michigan, the Kent County or the Grand Rapids area. So if you guys are selling in that area for the past consecutive 3 years, Molina has been price position #1 in Michigan, especially in the Grand Rapids area, in which we have pretty much all the major hospital systems, such as Spectrum, Metro Health System, and the Mercy Health System. And in the Wayne County, Macomb, and Oakland, that's the Detroit market, and the suburb of Detroit, such as Troy area. Molina is positioned fairly well with, in fact, a very minimal price increase compared to our competitors. One of the top carrier in that state, Priority, is actually going up by 19 percentage point. So I'm getting a lot of calls from many of you asking, for contract with Molina, what the product is going to be, what our commission is. So you'll see. I think we're going to see some movement in this market. Molina should certainly do well. We did extremely well last year, especially in the Grand Rapids market. We anticipate we'll do well. Our network is very, very good. And I'm going to go over the network for each of these states. So we will continue to have the Molina Healthy Rewards program. I think we certainly would love for you to help us push this. This will offer members $200 for an incentive program, which, basically for doing their wellness exam with their PCP and doing an health assessment. There's a suite of health tools such as programs, topics like smoking cessation, hypertension management, diabetes management. So it's a great program that members can access through their My Molina portal, member portal. Certainly, please help us push this. The utilization has increased from year to year. Somewhere, what I'm hearing is about 65 or so percentage. And we love to see this utilization increase to upwards of 80% with your help. The RX savings solution is something that we kicked off last year. This is an RX savings program that will help members with maximize their prescription benefit, which will help lower their out-of-pocket costs. Now, this is similar to the pharmaceutical assistance program where they have reduction programs that they have, similar to that. Members will receive information on this with their welcome packet. And the 800 number here listed for you as a number that they can call for additional information. But we'll email them whenever we have access to their email, and text them as well information containing our XSS program. Oops. I will also include this when I send you. This is just a QR code. So everything is QR coded now. This will help members and brokers go directly to these sites where you can enroll to have access to the member portal, to the various Molina resources as far as marketplace is concerned, finding a doctor, requesting member ID, which is something you are able to do as a broker now. It can help your clients with selecting PCP and changing member ID cards. Molina has unique member services number by state. So we want to make sure you give your clients the correct 800 number for member services. The broker number, the broker services number is reserved for you. So you want to make sure you give them this and not give the broker services number for all member services related by state. All right, payment options. Obviously, you know best that you want to set up a recurring auto pay at the point of enrollment. You are able to do that whenever you're enrolling either through healthcare.gov or even Sherpa. Members have the option of paying online through bill payments, by phone, by mail, by sending a check or money order to the address listed here, PO Box, or they may walk into any local MoneyGram locations to pay in cash. Last year, we added Google Pay and Apple Pay. There's a QR code that will take them to that site to make payments. In 2025, we're going to be adding a form of payment called Check Free Pay, and which members can actually walk in with their Molina invoice to any of these locations and their community to make payments in person. For enrollment and premium billing, there are specific numbers specific to each state that you want to make sure you give them the correct number for either if they're interested in making payments over the phone. Obviously, for enrollment, you will be enrolling them. So any payment issues, you want to make sure you give them these numbers. All right, so here's the benefits here. So these are the value add benefits that we've had in the past. So we'll continue to offer 24 hours, 7 days a week telehealth, virtual care services through Teledoc. Now, this year is going to include mental health services, which is a big deal. So this is unlimited, available to all members across all plans, regardless of which plan they have, and it's free of charge. It doesn't cost them anything to take advantage of this. We will continue to offer no-cost preventative prescription drugs, no-cost preventative screenings for children and adults, and pediatric vision services, which is serviced by VSP. Members will have free annual exam, free glasses, frames, contact lenses. The allowance is $150. The RX Saving Solutions we just went over, and the 24-hour, 7 days a week nurse advice line. The Molina Rewards program, which offers $200, is also value-add benefits for our members. Looking at our 2025 Molina portfolio state by state, so let's look at Ohio. And Ohio will continue to have the renewal options of the Silver One 100, 150, 200, and 250. These options will have the adult vision option. We'll also offer the RCMS standard Silver 8 option in Ohio and Michigan, except for Kentucky. We won't be offering it in that state. And Kentucky will offer the Silver 1, 150, 200, 250, as well as the Silver 12. The Silver 12, correct. So new thing, which is a big deal for Ohio, excluding Franklin County, we will be offering the bronze option. I think the last time we offered the bronze option is back, 4 years ago. So very happy that we are able to offer these. The bronze 8, bronze 9, and bronze 10 will be specifically offered in Ohio, excluding Franklin County, Columbus market. So looking at bronze, we won't go over the bronze 4 because it's not available in Ohio. Bronze 9, Ohio, excluding Franklin County. This is a Molina mid-deductible option, keeping out-of-pocket max in line with other products. The plan is expected to attract members with conditions who tend to exceed their out-of-pocket max. Bronze 10, again, excluding Franklin County. This is a Molina low deductible option and 50% co-insurance, aimed towards low, medium level utilizers. And then the Bronze 8 is similarly designed to the CMS standard option. That's our CMS standard option with minimal change from the past, even though it wasn't offered in Ohio. That would be offered in Florida, Mississippi, and Ohio, excluding Franklin County. So these are really excellent products. So if you look at the bronze 10, which will be offered in Ohio, the deductible is as low as $2,850, right? And we'll have quite a number of benefits, including tiers 1 and 2 preferred generics medication that can be accessed basically just based on copay with deductibles waived across all of these plans, in fact. Our silver option, so the silver one is a plan intended to be a buy-up option for consumers over our silver 12 offering. More co-payments, more co-share, along with lower medical deductibles and out-of-pocket max. Silver one retains member-friendly cost share features such as co-payments, primary care, specialist, office visit. All of these services can be accessed based on copay with deductibles waived across all of these benefits. Silver 12 is the low-cost option that we will offer. This plan is going to give members 4 free primary care visits per year. And then the CMS standard option is the Silver 8, and that would be also offered in Ohio, our standard option. And I have the benefits at a glance, which I will send, which will show you at a glance services that will not require meeting deductibles or deductibles are waived. The gold option did really well due to its low deductible across the board here. Last year, I think we can see it doing well in certain areas, even compared to the silver option. So we will continue to offer. So at $1,550 and $1,500 deductible, where similar to the silver option, deductibles will be waived for quite a number of benefits, including preferred generic medications. Telehealth we just covered. Now the big thing is that it does include mental health services. The adult vision option is also serviced by VSP. This is for additional premium. With the silver one, members can choose to add adult vision option. A similar design, so it's going to have free annual exam, free glasses, frames, contact lenses, routine retinal screening is also included in this. The allowance similar to the pediatric vision is going to be $150. So just remember that Molina has 3 lines of business: Medicaid, Medicare, and ACA. All 3 lines of business have a completely different network. So when searching our online provider directory, you want to make sure you're looking at the Molina Marketplace for your state and make sure you're searching the correct geographic areas or zip code or city that you're looking for providers. That's really the key here, but it's an excellent tool. All right, we have designed quite several pieces with you in mind. So these are advertisement or flyers and brochures that you can order free of charge, 50 at a time, in which you can customize them to put in your name, your business name, your contact information. You can use them to advertise online, or you can use these to distribute in your area. You can print them. Yeah, you could also request that we send you online about 50 at a time. So you can order as many times as you want. We can only send you 50 at a time per order. This is another brochure designed specifically for our brokers, which also gives you the ability to customize it, in which you can put in your contact information here. The benefits at a glance, these are samples. I do have them, the actual ones by state. When I send out the training deck here, I'll send it out. So highlighted in blue are services in which deductibles will be waived. So members can access these based on co-insurance or just co-pay. This is the state fact sheet, which is a sort of a cheat sheet that we've designed just to give you at a glance the state map, the value add benefits, and then provide a network hospital systems by county for each state. I'll send those as well.
Hey, Kahassai, real
Yeah.
quick question. Will agents be able to find the 2025 network selections out on your website?
Yes, it's up and running. Our website is updated on a weekly basis, so
Hmm.
every hospital system that should be in network starting January should all be in the system right now.
That's terrific. That's
Nice.
incredible.
So the molinamarketplace.com is just a one-stop location for everything Molina ACA. I'm sorry. So you are able to toggle between 2024 and 2025 plans. You have access to summary of benefits, evidence of coverage, direct formulary, benefits at a glance, all forms, including mail order pharmacy forms. Just to point out, our mail order pharmacy, our pharmacy vendor, CVS Caremark. We do have Kroger's, Walmart's, several mom and pop individual pharmacies, except Walgreens is not a network. So it's based on CVS Caremark. And members are able to attain a 90-day supply at 2.5 times the copay as well if they do order a mail order pharmacy, use the mail order pharmacy. And this site will take you to the broker portal, to the provider network, to member sites, and it'll give you tons of information. It's just a one-stop location where we put everything. A QR code here will also directly take you to the site. Our broker services is located in Salt Lake City, Utah, right here in the United States. Great team. I think I brag about them. I think we have one of the top broker services team in the nation. So you want to make sure you call the 855-885-3179. They're open from 6 a.m. to 6 p.m. Mountain Standard Time, Monday through Friday. During open enrollment, they may open up Saturday hours. Those will be e-blasted to just let you know specifically. And then our broker portal is called Evolve NXT. If you haven't logged in, please do so. Make sure that you are ready to sell. It's going to show you whether you're RTS or not. Anything that you need to do to update your status, please do so. And the email for broker services and the QR codes to take you directly to these sites are here for you. OEP readiness checklist. So let's make sure that you have gone through the training documents here, complete any CMS requires state-based trainings, certifications, and then FFM certification. And then you want to make sure that you access the Molina Broker Portal by navigating to My Credentials and selecting My Sales States. It's going to show you state by state, if you're a multi-state, appointed in multi-states, whether you RTS or not. So let's make sure you do that. Otherwise, you won't get paid. If you're not RTS, you're not going to get paid. So you want to make sure that you are ready to sell. If you are a new agent coming through just now, until you receive your welcome email from Molina authorizing you to sell, please do not submit any policies. Again, make sure you log in and check your status. Very important. You want to make sure that you get paid for all the hard work that you do. So, and then these QR codes are going to take you to the open enrollment training, to a broker portal, to the marketplace store in which you can order those flyers and brochures that we just went over. Evolve. Your username is always going to be your email address, whatever we have on file for you, and then you can reset your password if you're locked out by saying lost or forgot password. If you still have issues, you're not able to log in, make sure you call broker services. They will help you reset your password. You are able to pull your entire book of business. I think very important to do it right now prior to OEP. So you have a list you are able to renew come, pretty soon now. So you want to make sure you prepare those. So you are able to filter these and download it into an Excel form by effective date, pay through date, net due amounts, and pending termination. Again, you are able to help your clients order member ID cards and help them change primary care. physician. So just to let you know, so we do assign our members a PCP, even if they don't select at the point of enrollment, right? Now, we don't list that PCP on their member ID card. They can switch their PCP as often as they like. We will not send them a new card. They can keep the same card. If a member is not aware who they're assigned to, since it's not mentioned on their primary care card, uh, no harm done if they go to anyone in network. Based on claims history on the back end, Molina is going to assign them to the primary care physician they're currently seeing. Say we assign them to Dr. Joe and they are going to Dr. Smith. We'll make sure that we adjust that. So they are continuing to see as long as Dr. Smith is in network. That's the key. So as long as members go to in network using the same card, no harm done. But we do assign them based on where they are, based on their zip code, because we do want them to have continuity of care, establish doctor-patient relationships. So it's important that we assign them to a primary care physician. The only way they would know is if they log into their digital card and access their digital card, then it will have the primary care sign listed there. All right, so very important is, I'm not going to go over every single points here, but just make sure to know that if you offer products, marketplace consumers, any organization, FMOs, GAs, and its contracted brokers and agents may not engage in any of the following practices or activities that are prohibited by practice, including but not limited to the ones listed. No discriminatory practices, forgeries. Make sure that you are attaining authorization for consent for enrolling an individual. Make sure that you're compliant with all CMS, Department of Insurance, federal, state, carriers rules. Happy to let you know that in Ohio, we will be increasing our street level commission from $16 PMPM to $20 PMPM. In Michigan, it's going to remain flat, but it was pretty decent as is at $24 per member per month. And then in Kentucky, it's going to go up from $18 to $20 PMPM.
Good news.
Yeah. So I'm going to go over the network just quickly. Jeff, if you would allow me here, I think I have it. Let's see, what do I have?
I love the high use of QR codes in the presentation,
I
Kahassai.
know.
That's amazing.
Yeah. So let's see.
Yeah, because a lot of people take pictures of some of the slides. So now when they do, they're getting
Can
actually
you
what you're
guys see
looking at.
this? So I just
Yeah.
wanted to go over the network for Ohio. So just to name the top county states here, counties for Hamilton County, it's going to be based on the Mercy Health System, Kettering Health System, and University of Cincinnati. Franklin County, Columbus is going to be based on Ohio State University Medical Center and the James Cancer Hospital. One keynote here: while the statewide network is available to all members, regardless of what county you're from, if you have the bronze option, you cannot access Ohio State University and the James Cancer. But if you live in Hamilton County, you want to go to the James Cancer and Columbus, and you have a silver option, you can. So all statewide network is available to all members. And Northeastern Ohio in the Cuyahoga County or Cleveland market, we have Lake Health, Metro Health System, and Southwest General. Now, Lake Health was purchased by University Hospital a couple of years ago, which is not a hospital system that's a network for Molina, but we have maintained contracts specifically with Lake Health to continue to be an option for our ACA members in that state. So those of you who are in that area may know that they have been purchased by University, but they still continue to have contract with Molina.
Kahassai,
In
you may
addition
want to tell
to,
your claims people that.
yeah, in addition, I know,
Right.
I know. In addition to,
Comments yours.
these networks in Ohio, we also have hospital systems in West Virginia to accommodate our members that are on the bordering counties, such as people on the border in what is it in
Wheeling.
Greene County, not Greene County. What is that? Gallia County. I'm sorry, Gallipolis area, the Ohio River, in Lawrence County, Kentucky, Ashland, Kentucky, there's a system called King's Daughter Hospital that is in network also for Molina members bordering counties on those tri-state, Kentucky, West Virginia, Ohio. We have some network systems that are available to our members who live in those areas. And I've listed them here for you. All right, and then looking at Kentucky. In Kentucky, our system will consist based on University of Louisville and Norton Hospital System. Those are the two major hospital systems that will be in network. In Michigan and Wayne County, which is the Detroit market, will have the Beaumont system, TriHealth, Henry Ford, Sinai Medical Center. So very, very good network in that area. And as I mentioned earlier, in Kenton County, the Grand Rapids market will have the Metro Health System, Spectrum, and the Mercy Health System there will be in network. So by county, there's a cheat sheet here for you to use at a glance.
Good network.
All right, that's really it, and I'd love to answer some questions that they may have on it.
Yeah. Well, Kahassai, you showed it earlier, and I thought it was really great. If you could send us maybe instead of just the network, but those state highlight pages that include the network, but also the county grid and a couple of key features. I think those are
They say it right.
really.
Yeah.
It was like a 11 by 17 or 8.5 by 14 size page. It was earlier in the presentation. You showed it.
Yeah.
Maybe it
I
was
will
in the
send.
marketing department or something like that, or in the
Okay.
marketing
Yeah.
portal.
Let me see. Are you talking about this here? These?
Not seeing. Keep going. Oh wait, I think it was a couple down from there because it had sample on it. Yeah, sample. Nope, 4 slides up, like 34.
Maybe up then. Let's
Wait,
see.
slow down.
You're talking about this?
29, 29, 29. No,
29.
keep going.
That's it.
No, it's two more. It was in that range. Keep going. Next, 31, page 31, 32. It's 32 actually.
Yeah. The safe factory.
Yeah.
Yeah. That's what this is.
Oh, it is. Okay. I'm
Yeah,
sorry. I just saw
it's a
the
two
wider
pager. It's
sheet.
a two pager side by side, which will give
Okay.
you the map of each state with the value add benefits
Highlights.
and highlights, and then it's going to give you
Terrific.
the list of
Terrific. That's
network
great.
by hospital.
Yeah.
These are really nice cheat sheets that you can have at a glance at
Oh,
your desk,
yeah. Big
so you
time.
know at least what hospital systems are in network.
Yeah. Love it.
Yeah.
Yeah. They can put them
Did we have any
in their
questions?
briefcase if they're going out. Jeff, you seen any questions?
Well, I have a question. I think a lot of folks are busy this time of day and whatnot, so I'll ask a question on their behalf. Can you tell us more about the diabetes program?
I'm sorry.
The diabetes feature on one of those plans? I think it was a silver plan.
On what about the silver plan? I'm sorry, I
Oh,
missed
I
it.
saw something about diabetes. Can you maybe
Let's go
elaborate on that?
down. You're talking on this here.
Yes.
Slide 20.
Yeah,
Slide
that's Texas.
22. There we go. Oh,
Yeah.
Well, diabetes. I mean, I don't know if
Diabetes.
this doesn't mention diabetes. I don't know if you saw that, but
Oh, I saw it in there on one of the
on one of the
slides.
slides.
Yeah, everybody will.
You're
Yeah,
talking
yeah.
about this slide here. Hold on. I know what you're talking about.
Okay, thanks.
Yeah. You're talking about this, the rewards program, in which
Yeah, that's what I meant. Sorry, the diabetes
yeah.
management.
So
Okay.
basically, this is basically to recognize members who are taking steps towards better health, making
Hmm.
sure that they see their PCP for routine medical care or for their annual wellness exam, and
Hmm.
making sure that they also do a health assessment, and that's gonna, earn them $200 in gift card. And we have vendors in which they can choose different products to order directly online.
I love this.
Anyone
I
18
love
and
this.
over is able to participate. So this is a wellness program also which provides a suite of health tools such as these topics: smoking
Oh, that's
cessation.
fantastic.
These are completely free of charge. Hypertension
Great.
management,
Hmm.
diabetic management. There are educational programs that they can participate in.
Fantastic.
But obviously, diabetes and how it's covered as far as their medications or uh, the machines that they use,
Hmm.
all of
Yeah,
that will become.
Lancets. Yeah.
Yeah,
Hmm.
yeah, absolutely. Yes.
That's all I
Right. They
had.
just
That
have
should
to
be
log
under.
into the My Molina portal
Hmm.
And
and
we have
answer
benefits
essentially a health
interpretation.
assessment.
Yeah, we have benefits interpretation online that's gonna give you details on how each of these benefits are covered.
I think that does it.
Yeah, perfect. Great, concise
And
presentation.
and I'll send you a copy of this, including the state fact sheets and
Yep.
then the benefits at a glance
Yes.
for all states,
Perfect.
just in case you have individuals who may be selling across all of our markets.
Yep.
So you have copies of that
And we
as a
do have
reference. I'll
some of
send you all
those.
15 states.
Perfect. That's
All right.
perfect. Yep. So yeah, it must have been good. So we're in a whole lot of questions, but I think I'm seeing the names on here, and they probably joined the earlier one, which was had
Yeah.
some different slides. So I think this is great, Kasai. We really appreciate you giving us a little extra time again to just illuminate some of the really nice things with Molina's health plans for 2025. Again, it's an important carrier for us, for our brokers who write it, and so it's got a viable option, nice benefits, good network. Um, so yeah, so that's it. I don't want to keep everybody on. I know people have some selling to do. So thank you very much,
Thank,
Kasai, again, and we'll talk to you soon.
all right.
Bye, everyone. Take care.
All right.
Thanks.
Thanks a lot.
Have a great
All right,
day.
you got it. See
All
ya.
right.
Bye.